Medial side of thigh. Introduction. The adductor or medial compartment of thigh is very wefl developed and is derived, as indicated by its nerve supply from both the flexors and extensors between which it lies. Its counterpart in the arm is represented only by coracobrachialis muscle, as the arm can be adducted by pectoralis major and latissimus dorsi muscles. Adductor compartment, dissection. The triangular adductor longus was seen to form the medial boundary of femoral triangle. Cut this muscle 3 cm below its origin and reflect the distal part laterally. On its deep surface, identify the anterior division of obturator nerve which supplies both adductor longus and gracilis muscles. Lateral to adductor longus on the same plane is the pectineus muscle. Cut it close to its origin and reflect laterally, tracing the branch of anterior division of obturator nerve to this muscle. Obturator nerve is accompanied by the branches of obturator artery and medial circumflex femoral arteries. Deeper to adductor longus and pectineus is the adductor brevis. Look for its nerve supply either from anterior/posterior division. Divide adductor brevis close to its origin. Deepest plane of muscles comprises adductor magnus and obturator externus, both supplied by posterior division of obturator nerve. Lying vertically along the medial side of thigh is the graceful gracilis. Study these muscles and the course of obturator nerve. Look for accessory obturator nerve. If present, it supplies pectineus. Lastly, remove the obturator externus from its origin to expose the obturator artery and its branches. Boundaries. The adductor or medial compartment of the thigh is bounded anteriorly by the medial intermuscular septum which separates it from the extensor, anterior, compartment, and posteriorly by an ill-defined posterior intermuscular septum which separates it from the flexor, posterior, compartment. The structures to be studied in this region are muscles, nerves, and arteries. These are as follows. Muscles, L. adductor longus. 2 adductor brevis. 3 adductor magnus. 4 gracilis. 5 pectineus. The obturator externus lies deep in this region. It is functionally related to the gluteal region. Nerves. 1 obturator nerve. 2 accessory obturator nerve. Arteries. 1 obturator artery. 2 medial circumflex femoral artery. The attachments of the muscles are given in Table 4.1. Their nerve supply and actions are given in Table 4.2. Relations of adductor longus. The relations of the adductor longus are important. They are as follows. Anterior surface. 1 spermatic cord. 2 great saphenous vein with fascia lata. 3 femoral vessels. 4 sartorius, Fig 4.3. Figs 4.2a and b. Insertion of muscles, a. Posterior aspect of femur, and b. Upper part of medial surface of tibia. Posterior surface, 1 adductor brevis. 2-3 adductor magnus. 4-3 anterior division of obturator nerve. 4 profunda femoris vessels. Later at border, pectineus. Medial horde.r, gracilis. Obturator nerve. The obturator nerve is the chief nerve of the medial compartment of the thigh. Origin and root value, it is a branch of the lumbar plexus. It is formed by the ventral divisions of the anterior primary rami of spinal nerves L2, L3, L4. The upper part of the nerve lies in the pelvis. It enters the thigh by passing through the obturator canal. Course and relations in thigh. Within the obturator canal the nerve divides into anterior and posterior divisions. 1. The anterior division passes downwards in front of the obturator externus being separated from the posterior division by a few fibers of this muscle. It then descends behind the pectineus and the adductor longus, and in front of the adductor brevis. The anterior division supplies the following muscles. Pectineus. B. Adductor longus. C. gracilis. Adductor brevis if not supplied by the posterior division. The anterior division also gives a branch to the hip joint. Below the lower border of the adductor longus, it supplies a twig to the subsartorial plexus, and ends by supplying the femoral artery in the adductor canal. 2. The posterior division enters the thigh by piercing the upper border of the obturator externus muscle. It descends behind the adductor brevis and in front of the adductor magnus. It gives branches to the following muscles: 3a obturator externus, 4b adductor magnus, adductor brevis if not supplied by the anterior division. In the adductor canal, it is reducted to a thin genicular branch which enters the popliteal fossa, pierces the oblique popliteal ligament and ends by supplying the capsule and the cruciate ligaments of the knee joint. Some of its fibers end by innervating the popliteal artery. Testing the adductors, the patient lies supine with right lower limb abducted. The right hand of physician holds the leg in abducted position. Patient is requested to bring the thigh medially against the resistance of the physician's right hand, while his left hand feels the contracting adductor muscles. Spasm of the adductors of thigh in certain intractable cases of spastic paraplegia may be relieved by surgical division of the obturator nerve. A disease of the hip joint may cause referred pain in the knee and on the medial side of the thigh because of their common nerve supply by the obturator nerve. Obturator nerve may be involved with femoral nerve in retroperitoneal tumors. A nerve entrapment syndrome leading to chronic pain on the medial side of thigh may occur in athletes with big adductor muscles. Ventral divisions of the anterior primary rami of spinal nerves L3 and L4. It descends along the medial border of the psoas major, crosses the superior ramus of the pubis behind the pectineus, and terminates by dividing into 3 branches. One branch supplies the deep surface of the pectineus, another supplies the hip joint, and the third communicates with the anterior division of the obturator nerve. Sometimes the nerve is very small, and ends by supplying the pectineus only. Obturator artery. 1. The obturator artery is a branch of the internal iliac, and accompanies, lies below, the obturator nerve in the pelvis. 2. At the upper margin of the obturator foramen, the obturator artery divides into anterior or medial and posterior or lateral branches which form a circle over the obturator membrane and anastomoses with the medial circumflex femoral artery. 3. Both branches supply the neighboring muscles. The posterior branch also gives an acetabular branch which passes through the acetabular notch to supply the fat in the acetabular fossa and sends a twig to the head of the femur along the round ligament, foveolar artery. Medial circumflex femoral artery. This artery arises from the pronda femoris 1. It leaves the femoral triangle by passing backwards and ends by dividing into ascending and transverse branches. 2. Ascending branch of medial circumflex femoral anastomosis with ascending branch of lateral circumflex femoral and superior gluteal artery to form trochanteric anastomosis. This gives retinacular branches which lie along the retinacula of capsule of hip joint to supply head of femur. 3. Transverse branch anastomosis with transverse branch of lateral circumflex femoral, inferior gluteal, and first perforating branch of profunda femoris to form cruciate anastomosis. 5. Before giving off the terminal branches, the artery gives off many muscular branches, and an acetabular branch which passes through the acetabular notch to supply fat in the acetabular fossa. It also sends a twig to the head. 1. The demur along the round ligament, foveolar artery. Gracilis muscles is most superficial muscle of the adductor compartment. This muscle is often used for transplantation of any damaged muscle. Intracapsular fracture of neck of femur causes damage to the retinacular branches, which supply head of femur, leading to avascular necrosis of head of femur. Obturator nerve arises mom ventral divisions of ventral primary rami of L2, L3, and L4 segments of spinal cord, whereas femoral nerve arises from dorsal divisions of ventral primary rami of the same segments. Adductor magnus and pectineus are 2 hybrid or composite muscles since femoral and obturator nerves supply both the hip joint and knee joint. Pain from one joint may be referred to the other joint. Obturator nerve is seen at the medial border of psoas major muscle, crosses the ala of sacrum to enter the pelvis. It exits the pelvis through the obturator foramen to enter the medial aspect of the thigh. Obturator artery branch of internal iliac and medial circumflex femoral, branch of profunda femoris are seen on the medial side of the thigh.